Now, as I mentioned earlier in one of the slides, the drugs that we're talking about are not static and they're not all the same. The drug itself influences the psychology of the person taking it from the very first use. And that means when we take the drug, we feel differently about the drug and we think differently about the drug. And it's very important for us to understand this concept that each drug, as I said before, essentially has its own personality. This is a graph that was put together summarizing data from Jack Henningfield from the National Institute for Drug Awareness. And what I like about it is that it looks at 5 different indicators or criteria for a number of common substances. And you can see that 3 of them are not legal in Canada: heroin, cocaine, and marijuana, and 3 of them are legal, at least for some of the population: nicotine, alcohol, and caffeine. And we're going to talk a little bit about the idea of the reinforcement concept in particular a little later on. But when you start to look at the various profiles of each of these drugs, you might start to understand not only why some are legal and why some aren't legal, but also why a person might choose one drug over another. So the very first criterion here is dependence. In other words, how quick is this drug to make an individual, or how strongly does this drug make a person feel as though they need to keep using it? And if you look, curiously, nicotine is one of the most dependence-causing drugs there is. And this, of course, should not be any great surprise for us because, for example, I've worked over the years with many people who were recovering addicts from heroin or crystal meth or crack cocaine, but they couldn't stop smoking. And that is not an uncommon thing. A lot of people will tell you that it's the hardest drug that they ever will have to give up in terms of that feeling of dependence. And perhaps you've heard people say, for example, that they stopped smoking 20 years ago and yet they still crave cigarettes. Withdrawal and dependence are closely tied together, but they're not identical. Withdrawal can be described as strong cravings or as drug sickness, the feelings that people have when they stop using a drug. And it can be anything from the headaches that people experience when they stop drinking coffee to the strong cravings and irritability a person sometimes experiences when they stop using cigarettes, to the actual physical illness that comes when a person stops consuming heroin. And that's this one right here. And you can see that heroin is one of the drugs that has one of the highest withdrawal symptoms. Alcohol as well, and you can see 6 and 5 for these two. And this explains part of the reason why people who are withdrawing or detoxifying from heroin and or chronic alcohol use often need medical supervision during their detoxification, because the sickness, the feelings of illness that a person will experience are so dramatic that they can actually be physiologically dangerous. And you might have heard the expression the DTs, which stands for the delirium tremens. The delirium tremens means the person is literally shaking, they're in shock, they have many shock-like effects, delirium and so forth, and it's generally associated with withdrawal from alcohol. So this is another reason why some people continue with the drug. It may make them feel sick to use it, but it makes them feel more sick to stop using it. Tolerance is also closely tied with dependence and withdrawal, and what tolerance means is that a person gradually develops an ability to withstand more and more of the drug, or another way of looking at it is that they need to take more and more of the drug to get the same type of impact or effect. You can see that nicotine is quite high at 5, and this explains why people gradually over the years go from being smokers at 1 or 2 cigarettes a day up to 2 or 3 packs. And the same thing is true of heroin, which is a 6. Heroin has got an extremely high tolerance, and this is part of the reason why people often have a very difficult time getting off of heroin and need to utilize substances like methadone. Way down here is marijuana. Marijuana, still possible to become dependent on it, and to become tolerant on it and to have withdrawal to it. But to give you a comparative number, 1 out of 4 people who utilize heroin will likely become dependent on it, whereas only approximately 4% of people who use marijuana at any given time will become dependent on it. The interesting thing about it is there are many more people in our culture who are addicted to or dependent on marijuana than heroin. Why is that? Well, it's partly because these numbers are low and because people perceive marijuana as a safer, more acceptable drug. More people use marijuana by a considerable margin than use heroin. And so the percentage of users who become addicted is lower for marijuana, but the overall number of people who are dependent on it is higher. And there is no drug that is more likely to see a person be addicted to it, or more, where there are more addicted people than alcohol, because alcohol is such a drug that has a higher amount of tolerance and dependence, and it is also very much available to people, of course. So alcohol is still essentially considered to be the most abused drug in society today. Reinforcement is something I want to talk more about later on, but reinforcement simply means that this refers to the kind of payoff value that a drug gives to a person. How good does it feel? How rewarding is it at a physiological level for that person to use that drug? And you can see that nicotine is out of 3 out of 6, so it's relatively rewarding. And it's an interesting phenomenon that happens with nicotine, and it happens to some extent with other drugs as well. And I can only speak about some of this from my personal experience. I don't recall ever feeling a sense of elation or well-being from smoking cigarettes, as much as I recall feeling a negative reinforcement, meaning a release of stress. Things that were unpleasant were diminished because of the use of the cigarette. And after I became addicted to cigarettes, and this is purely anecdotal, of course, what I found was the biggest stressor that I had was the feeling of withdrawal. In other words, the fact that I was having a nicotine fit, so to speak. I needed the cigarette. Nothing stressed me out as much as not being able to go and have a cigarette. Now that experience is an anecdotal story, but it's reflective of what people will tell you not only when they're addicted to cigarettes, but to many other substances as well. That after a while, the most important thing for them is using that substance, and the biggest reinforcement out of it is often that they have stopped the temporary anxiety that they've had because they've been withdrawing from the substance. Again, you'll see that the two most reinforcing drugs, or two of the most reinforcing drugs here, are heroin and alcohol at 5 and 6. But the single most reinforcing drug is cocaine, because it gives people a very extraordinarily quick impact and a feeling of a dramatic high. In the earlier slides, we talked about the fact that cocaine is a very good replicant of dopamine, the neurotransmitter that makes us feel very, very good. And so cocaine goes directly to our brain, makes us feel this extraordinarily good sense of well-being, and that's part of the reason why it's an addictive drug. And then lastly is intoxication. And I started this discussion by saying we must remember that the drug has an effect on our thinking and our feelings from the very beginning, but it also has an effect on the lucidness of our thinking, the lucidity. How clearly are we thinking? And the less clearly we think, the more difficult it is for us to see the impacts of the drug. And you can see that heroin, cocaine, and alcohol all have that type of effect. Now, interestingly, go down and look at marijuana. Marijuana, not terribly quick to cause a physiological dependence, withdrawal, or tolerance, somewhat more reinforcing, but it's in the middle ground in terms of intoxication. And this is part of the reason that marijuana has this insidious effect. It is not going to make us so altered in our perception that we realize, in some cases, that our perceptions have been altered. When we're drunk from alcohol, we usually realize that we're drunk from alcohol. But when we are stoned from marijuana, we perhaps don't realize, except in the short term, that the effects that the drug is having on us. And so the thing about marijuana that's interesting, it has a fairly long half-life. It can take up to 30 days for the effect of one marijuana joint to be dissipated from the system. And that means that the cumulative effect of a person who's smoking marijuana every day gets to be quite substantial. But it's something that sneaks up on the person, and before they know it, it's affecting things like their motivation and drive, their volition, the clarity of their thinking, and as a result, the person doesn't see that their perspective on the use of the drug has been altered as a result of the very use of the drug. So as we said earlier, there are a number of physiological factors that play a role here as well. So to sum up, the drug type, as we just talked about, has a great deal to do with it. Some are more quickly addictive, some are more reinforcing, some are more likely to cause drug sickness or withdrawal, some are more likely to intoxicate and cloud the judgment of the user. We also need to talk again about genetic predisposition. And if you were in Module 1, you've heard this before, but let's quickly review it. We for a long time thought that the way our genetics worked was that the codes printed in our DNA dictated or predetermined exactly how we would turn out. And we were particularly of the opinion that our genes described our physiological makeup, the color of our hair, the color of our eyes, our height, our body weight, and so forth. We have come to understand a few more important things. First of all, our personality is to a large extent dictated or affected by our genes. And this is why, to some extent, things like traits like stubbornness or talkativeness can be passed down generationally. It's also true that our genes do not always predetermine or dictate exactly who we may become. Some of our genes determine or suggest that particular traits are more likely, and this is what we mean by being predisposed. If we're predisposed to something, it means we are more likely to experience it. And this predisposition can occur with a number of things. For example, a person may be more predisposed to become overweight, may become more predisposed to breast cancer, or may be predisposed to alcoholism in this particular instance. And what this suggests is that the science is studying the idea that some parts of our genes can be turned on or off by things that happen environmentally around us, or that happen, curiously, in the generation before us. In other words, something happens in our parents or even our grandparents' generation, and so that the next time the genetic material is passed from them to you, a gene may be turned on. That same gene may then be turned off by you to the next generation, and so forth. What happens in some of these cases is that the person may be exposed to some environmental or psychosocial events that essentially make that gene start to work. And a lot of people have said to me, so what I mean is that the person drinks alcohol and that gene comes alive and off they go. Well, the research doesn't seem to indicate that it's just about testing or trying alcohol. It's more likely that the person, for example, has been exposed to some kind of psychological stressor or psychological trauma, and that is what sort of led their brain to move more in terms of a pattern of coping that involves addiction or dependency on either a behavior or a substance. So we hear people talk about drug addiction as a disease. That's a common expression I hear from people in the drug and alcohol counseling side of things. And I think in many cases they're referring to this idea that alcoholism has a genetic connection. But it's important for us to understand that the term disease is not any more accurate than saying that there is no genetic connection, because the person was not predetermined to become an alcoholic either, and neither are they required to stay an alcoholic for the rest of their lives because it's dyed in their wool. There are things that can be done to help that person reverse the behavioral effects of their addiction, in spite of the fact that genetically they may have that predisposition. The metabolism of the user plays another vital role. And this should be very simple, but it may not occur to us. For example, I stated earlier that 1 out of 4 heroin users will become habituated to the drug. Why not all 4 out of 4? Well, one of the reasons is that heroin often makes people feel sick when they take it. So it has a great deal to do with the individual physiology of the person trying that drug. Some people try it, find it extremely averse, and never take it again. Other people try it and find that it doesn't do a great deal to affect them. They're not as reinforced, and therefore they are neither here nor there, neither compelled to use it, nor are they averse to using it. And then there's that 25% in the case of heroin who find it very reinforcing and who are also affected by the withdrawal effects, and therefore they're more likely to become addicted. So each of us is somewhat different than the next person. physiologically and psychosocially, and so how the drug will impact us will make a big difference. And you can see why it's so complex when you see the combination of these factors to see why one person might become addicted and another might not. How does it affect that person's, if that person tries a drug at a certain age, whether that person's of a particular gender, whether they come from a certain psychological or social, I should say, background. All of these things converge together, and each person's story is unique. The story of addiction has many common threads, but every person that's addicted will have a slightly different pathway, and in some cases very different pathway toward the use of that drug than the next person.